Good morning and welcome to IPMG's third installment of our webinar series, The Big Picture and Beyond, What the COVID Crisis Has Taught Us. I'm Greg Peterson, President and CEO of IPMG. Today we're going to be covering the impact of the crisis on absence management programs, the resources necessary to manage the crisis from an absence management perspective, and changes to the Family Medical Leave Act, the legal landscape, and how it has adjusted to address this issue, and also to provide some additional information for you folks so that you can better prepare yourselves in the event that something else should come along in the future, or just simply in the daily management of your absence management program. Our fourth installment will be next week, next Tuesday at the same time, when we'll wrap up the discussion and we'll talk about the inefficiencies of the siloed approach to workers' compensation and employee benefits, which really has shown itself in a very harsh light throughout this whole crisis. So in our previous discussions, in our previous two webinars, we really were focusing on the primary candidates who, when catching COVID, have the most difficulty and struggle with the severity of the COVID issue. In a recent CDC study that was released in May, or the middle of May, they identified that in prime working age employees, and that's age 30 to 59, those who had 3 or more comorbidities, roughly 20% of the folks, and you're looking at a screen which is the numbers that would be across all population, and we narrow it down then to the folks who are in the prime working age, so that we take out the age-related issues. But it was uncanny that those folks who had roughly 2 to 3 comorbidities, which are cardiovascular, diabetes, chronic lung disease, and all the issues that go along with those particular chronic issues, they were 6 times more prevalent. Hospitalizations were 6 times more prevalent among that group, and death was 12 times more prevalent. The uncanny aspect of these numbers is that if you take those numbers and you lay them over the average work population outside of the COVID-19 crisis, what emerges is that that same group, that 20% that have 2 or more comorbidities, without the COVID-19 crisis, are still driving roughly 80% of the costs and expense of healthcare that employers are paying on an annual basis. Then when you factor in dollars that are related to productivity, loss of opportunity, training, overtime, and all those things that come into play, whether it be workers' compensation or benefits, employers are spending roughly $1 trillion to address the issues and the costs that are being driven by 20% of the working population. That same 20% that are dealing with the most severe issues around the COVID-19 crisis. When they catch the disease, and the severity of the disease is dictated very much by those same issues. So the inordinate amount of resource that employers are spending to address the 20% issue with regard to the COVID-19 crisis, and the 20% issue driving 80% of the costs outside of the COVID-19 crisis is significant. So we are trying to address that issue and identify tools and resources that we can help you with. Last week we talked about the tools that we have to bridge the gap between workers' compensation and employee benefits, which is our enhanced case management program. Dr. Kim Gasson, our clinical field director, as well as Brian Devlin, Senior VP of Risk Management for IPMG, focus squarely on those issues and to give you an insight to the tools and resources available to be able to address that. Today, we're fortunate to have 2 solid representatives to help us navigate the absence management FMLA landscape. Kim McMahon, who's our Director of Absence Management and Nurse Case Management, will be talking about the daily absence management aspects of COVID-19, as well as the tools and resources that can be employed to assist employers to better manage their absence management issues, as well as FMLA. And then we have Julie Bruck from O'Halloran, Kossoff, Geithner, and Cook, who specializes in employment law. And Julie will be talking about the legal landscape and the changes to FMLA. And Cliff Kossoff will be joining us as well. And Cliff is the principal at O'Halloran, Kossoff, Geithner, and Cook. And Cliff will be available to help support any questions and thoughts that you folks may have. We ask you to please, if you have questions, send them in. We'll try to address them throughout the webinar today. And if we're unable to get to all the questions, we'll make sure that we get answers out to the group. And without any further ado, I'd like to turn it over to Kim McMahon. Kim?
Good morning. Thank you. Next slide, please. Okay, I wanted to look at some additional information regarding COVID and the underlying conditions. So I provided some updated information from the CDC that was updated on June 25th. So this just gives a little more information in what we were looking at. So among adults, the risk of severe illness increases with age, and then obviously the older population is at the highest risk. There's certain population groups, it doesn't matter what the age is. There's specific underlying medical conditions that actually put them at an increased risk. So those listed are chronic kidney disease, chronic obstructive pulmonary disease, immunocompromised, so we're looking at organ transplant, obesity, so we're looking at a BMI 30 or higher, serious heart conditions, sickle cell disease, as well as type 2 diabetes. Next slide, please. They also had some additional information, and again, because this was so new, they pushed it up based on what we know at this time, is what the CDC was saying. These other conditions might be at increased risk for severe illness. So you're looking at asthma, cerebral vascular disease, hypertension or high blood pressure, immunocompromised. So that area is, several different areas in that. So we're looking at transplants, immune deficiencies, corticosteroids, any type of immune weakening medicines, of course, HIV, again, might be at increased risk. Neurological conditions, liver disease, pregnancy, smoking, and then type 1 diabetes is at that point. Next slide. Looking at healthcare costs too, as far as the absence piece and the impact of it, we're looking at 178 billion. So we've got incidental absence, illness, workers' compensation, FMLA, 198 billion impaired performance that they're attributing to chronic health conditions, 48 billion in workers' compensation, medical, and pharmacy costs, 25 billion workers' compensation and other costs of absence due to illness and reduced performance, and then 82 billion. So revenues, lost revenues, cost of hiring temporary workers, as well as overtime. That information's from IBI. Next slide, please. Okay, what we found with this is flexibility was key. I mean, it was changing, evolving, pretty much daily at one point. So, we not only had the FMLA, in the regular portion, but then we also had the Families First Coronavirus Response Act, as well as the Emergency Paid Sick Leave, and then the Emergency Family and Medical Leave Expansion Act. I'm not going to go into those in detail. We've got Julie that will be touching based on that briefly, and I also wanted to encourage not only questions in this area, but also questions that you may have as far as, now we're seeing more and more employees returning to work. What does that look like? Also, COVID positive. You have an employee that's COVID positive. So, again, encourage questions, in those specific areas as well. Employer policy and short-term disability plans. So, with these changes, the employer policy needed, to be looked at, where there are, specific revisions or modifications or new policies that were needed, in those areas. Short-term disability plan. How did this impact, the current short-term disability plan, and how was that to be managed? Workers' compensation as well. So, you're looking at that, those absences. So, whether, it's COVID, 19 positive or, negative, or you've got lost time, several different factors playing in that, the tracking of that as well. Employee benefits and the increased cost there as far as the medical portion. And I also wanted to, all of these areas too, when we're looking, at chronic conditions, there's different resources available. Some of them have been discussed when you're looking at enhanced case management. You've got nurse case management as well, and workers' compensation and employee benefits, disease management, chronic condition management. Those are all, available resources that can help reduce some of those either emerging or some of those higher risks that we're seeing, not only impacted with COVID, but also just in the general management and what we're seeing. Legal, again, key, and Julie will be, speaking to that as far as the guidance and getting that specific information out to the employers. Next slide, please. Okay, as far as the largest impacts that we saw, it was primary driver was in that underlying condition. So it wasn't only, employees with those types of, diseases and the severe complications and stuff. It was really around the potential for exposure as well. So you had employees with underlying conditions that just by that nature put them at a potential higher risk in the event that they would contract COVID-19. So that was what we were seeing as far as, as the largest volume. It was significantly impacted as far as increase in volume. Work from home options versus non-accommodation. So, obviously with work from home options, best case scenario to be able to accommodate that. But obviously that's not always an option for, employers or specific departments or physicians as well. The key that we found was the employee contact and the employer contact. So that was, I'm going to discuss that a little bit further in the next slide. Making sure that the employee understands, as well as keeping, in contact with the employer and assisting them through that, making sure that, legal input is provided, the guidance and consulting as far as what is needed, what are the changes, and then also the additional resources as well. Next slide, please. Okay, when we're looking and discussing engagement and resources, what we're looking at is the clinical expertise. So we do have registered nurses that not only assist in the medical management or do the medical management, but they also act as consults for our certified leave management specialists. So they're, evaluating and looking, offering assistance. Is this a qualifying serious health condition, and providing input into that. So we, like I said, we do have registered nurses. We have several certified leave management specialists as well. As far as the engagement component of it, it's key. So when we're talking to that employee and we're doing that initial intake, we are, asking, those specific questions as far as the leave. We're letting them know, what the specific, role and what their responsibility is in this absence process. So they have a clear understanding of what to expect, and also making sure that they stay engaged and they stay attached, to that piece of it. Also ongoing contact. So it's throughout the leave process. So, not only are we doing the initial, then we're contacting them, ongoing. Are they going to need, additional time? Are they on track for that original return to work? What does it look like? Making sure, again, those, communication with that employer, with the HR contact, stays open. As far as assisting the employee to navigate the process and what we're looking at, so again, on that initial contact, we're, explaining what they should expect, and again, what their responsibilities are. So they'll be receiving eligibility determination, also designation notices as well. Eligibility, rights, and responsibility, what that means. Looking at necessary information to support the medical leave. So again, is it their responsibility to get that medical certification completed? Is it something that we can assist as well? We need that information and be able to medically support that absence request. Once that's received, evaluating that, taking a look at it. Is it something that can be approved? Is it additional information needed? Is it something that it isn't, able to be approved based off of the information that was provided? So again, focusing in on that engagement portion, looking, and ensuring, assisting with the coordination and facilitation of that return to work. So it's not only full duty, but also with the restrictions. So, some of those that maybe initially were not able to be accommodated, some of those work from home, maybe as time progressed and this became more prolonged, then, maybe that became available. Working with, the manager or, the employer contact, are they able to accommodate, any type of restriction? And again, if they're supposed to be, returning to work on a specific date, calling, confirming, did they return to work? Does the employer require a fitness for duty? That's something too that, would be communicated to the employee as well. So, we talked about, is the return to work on track? So if it's not, on the original date, then looking at, leave extensions and what that means as far as getting the necessary medical information and able to support that leave extension ongoing. So working, through that process until that full duty release. Next slide, please. As far as some additional resources, we do have Insight Online, which is a proprietary. It was developed internally. That is available for submissions. So we're looking at online submissions. It can be either initial, where they submit, or they can do intermittent leaves too. So something that's been approved, then they can do their actual ongoing input of the intermittent call-in information. They also have the option of phone as well. Tracking is key too. So there's several different leave types that can be tracked in Insight Online. So when we're looking at workers' compensation, so we've got workers' compensation as well as the FMLA portion of it running concurrently. So there's actually automatic triggers and alerts set up that, on our workers' compensation team, if a claim comes in, then it would alert our absence management team. So they can take a look and, and evaluate it further to see, okay, are there notices that need to go out? Is there time that is specifically tracked? Short-term disability too. So we've got short-term disability, and then we have the leave component of it as well that is tracked. FMLA, continuous, as well as the intermittent. The intermittent is, looked at and evaluated for patterns, trending, what we're seeing as far as that employee and the time being missed. Personally, too, we've got non-FMLA medical leave. So this is again, according to the employer policy, those items that fall outside, perhaps they're not eligible for FMLA for whatever reason. So that leave type can be managed and tracked in our system as well. And then obviously PTO and other too. So next slide, please. As far as the conclusion, increased costs were related to multiple areas when we're looking, at the impacts of COVID-19. So, benefits, medical, workers' compensation, medical. We've got lost days, productivity. It was seen across all areas. With again, that underlying condition and those comorbidities and the impact was, significant, and how it impacted the absence that we saw. We found it key to engage the employee, to identify and reduce those impacts. I mean, again, this was something new, with COVID. So it was really critical, to remain in touch with the employer as well as the employee, and helping them navigate through this new leave mandates. again, we would, deploy the appropriate resources to manage the medical as well as the return to work. Okay.
Kim, thank you.
Turn it over to Julie Brooks. Yep.
Before Julie, before you take off, this is Greg Peterson again. One thing that I'd like to add, or actually just to really reaffirm, is that throughout the three webinars that we've had here so far, the underlying theme is engagement with the employee and the critical issues that we've identified as far as the health issues, the comorbidities that are driving the severity of the COVID-19, as well as driving the severity of expense across the board for employers and workers' compensation benefits. And now, as you can see, with absence management, the critical aspect of all of this is engagement. And the idea of allowing the employee to be ill and or injured and absent from work without having proper daily, weekly, or engagement points, it just is a recipe for disaster for most employers. And that's where money, time, talent, treasure gets wasted for employers. It also is important to have a really good legal firm on your side. And we have O'Halloran, Kossoff, Geithner & Cook as a firm that we've done business with at IPMG since our doors opened. And I've been fortunate enough to work very closely with Cliff Kossoff, who's principal at O'Halloran, Kossoff, Geithner & Cook for over 30 years now. Julie, I won't say that you and I worked together that long because I would never do that to you, because I know you probably started working as an attorney when you were 15. So the reality is that we have to have everybody on deck to be able to do the work possible for our clients and to do it properly. And today you're going to gain some great insight as to the breadth of capabilities that O'Halloran, Kossoff, Geithner & Cook bring to the table, particularly Julie Brooks and her emphasis on employment law. She and Jane May, who is also with OKGC, were front and center when all this was taking place and the legal landscape was changing at such a dramatic pace. But never once did we falter and were unable to provide the right information for our clients. So looking forward to hearing what Julie and Cliff have to say today. Julie, please.
Okay, thank you, Greg. Good morning, everyone. So hopefully we have now settled into what is kind of our new normal, and you've had your employees who can telework, have been teleworking. And the issues are, how do you deal with these new laws? And if you want to bring them back to work, how do you do that in a way that is safe and works for both your employees and your business? As you can see from the slide, we've prepared a chart that will help you with the new laws. I suggest, if you don't have this chart already, that you screenshot it and use that as a reference if you have employees who need time off. So there's a number of different situations that can arise with your employees. If they are teleworking and they have issues that are COVID related, the question becomes, can they continue to work while they're still at home? It's possible that they can. In that situation, they won't need any leave. They're still working. They're not at risk. They're not placing any of your employees at risk because they're working at home. Then you don't even have to worry about any of this. But let's say now that you have employees who either have their own symptoms or they've been advised by a healthcare provider to self-quarantine. Let's say that they have children who they have to care for and it's impacting their ability to work full-time for you. That's when these new laws kick in. So under the emergency paid sick leave, hopefully everybody is familiar with this law where you can, it only provides essentially 2 weeks of additional pay. And once you use it, you're done. You don't get to continue to use it throughout the year. The end of this year so far is when this law no longer is in effect. So if you have employees who have used the law, they're done. Now under this expanded family medical leave, keep in mind that if you have an employee who has worked for you for a full year and has worked the requisite number of hours and they develop COVID, they're going to be entitled to your normal FMLA like you would for any other serious health condition. The expanded family medical leave is only when you have employees who need the time off for childcare reasons. That can be taken in a block of time or it can be taken in intermittent leave. Like, for example, let's say that you've got dad is going to work Monday, Wednesday, Friday, and watch the kids on Tuesday, Thursdays, and mom's going to do the opposite. In that situation, they can each take up to the 12 weeks under that expanded family medical leave. And you can see the chart on how you become eligible and what you need to do to comply with those laws. But now let's move into the issue of, now we want to bring our employees back to work. How can we do that safely? What we did, and I'll just kind of use our firm as an example, we started back starting June 1st. And in order to prepare for that, we looked through the CDC guidelines, we looked through OSHA guidelines, and we developed a plan for how to bring our employees back safely. And because we wanted to make sure we had buy-in of staff, we had our staff participate in a conference call. We did Zoom so we could see everyone, and we allowed the employees to ask questions, express concerns that they had, and we made adjustments. And so far, knock on wood, we've been back in the office since June 1, and we haven't had any cases. What I believe is the key to this is making sure that your employees have that separation from each other, so that if it does happen that you have an employee who is positive, it's not going to impact your entire workforce. So things like, we had plexiglass shields put up for employees who work out in an open space where they're not in an individual office. We had empty individual offices, and we moved employees that normally work in the open space, we moved them into those individual offices. We moved employees into our conference room. So you really have to kind of think outside the box, and how can we handle this situation in a way that people will feel safe. When you decide to reopen, there are going to be employees who are very hesitant to come back. So now, one of the things that we want to make sure that you are aware of is that the Americans with Disabilities Act is going to kick in for your employees who have those comorbidities, who have the chronic conditions, and they're concerned about coming back to an office space that would increase their risk of catching this disease. So what you're going to do with those individuals, just like you have for your other employees who have disabilities, is go through the ADA, the interactive process, where you have a one-on-one discussion with the employee on what are their concerns, is there anything that you can do that will allow them to return to work safely, and it may be that there isn't. And in that situation, you should truly consider allowing that employee to continue teleworking. So we initially, when we reopened the office, we had 3 of our employees who were still teleworking. We're now down to 1. So I think that as the employees who are initially hesitant become more confident in seeing that the work environment is safe, then you're going to have more and more people hopefully returning to work. The next question that we get pretty frequently now is, well, what do we do if you have that employee who tests positive? In that situation, if you've been isolating people so that they're not in close contact, then hopefully you won't have to shut down your entire workforce. Certainly you need to notify your employees that someone has tested positive. Keep in mind that there's confidentiality issues, so unless the employee consents to have his or her name identified and released, you can't disclose that. I mean, obviously people are going to figure out who it is, but you should not release the name of the person. Try to figure out from the individual who has tested positive, who in the office have they come into close contact with for 15 minutes or more. And close contact has been defined by the CDC as essentially 6 feet or closer. So those are the people that you should consider placing on leave and sending them home. Everyone else should still be able to continue to work. Many people advise having the facility cleaned. That's not necessarily a mandatory procedure that you have to engage in, especially since the latest guidelines have suggested that the risk of transmission on surfaces is not as high as it once was thought. Another issue that people have been asking a lot of questions on is, well, what do we do if our employees are using their vacation days to travel and they're traveling to an area that's a hot spot? Should we force them to, when they return from their vacation, to essentially shelter in place for that 14-day period? I've been recommending to clients that they not do so, and the reason being is that, number one, you're just going to get employees who lie to you and don't tell you where they're going on vacation. They're just saying, oh, we're just going to stay at home. So there's really no way for you to monitor that in a way that's going to be fair to everyone. The other issue is that you can have one employee who is being careful, but let's say that they live with family members who are like teens or in the early 20s, and they're out partying all the time, and they're at a higher risk from catching it from the family member versus somebody who goes off to Florida and they're visiting a family member there, and they're very cautious. They never go out to any restaurants or any bars, and they're not in contact with other people. Who's to say who is at greater risk? So ultimately, I am personally not recommending to clients that they force employees to shelter in place when they return from vacation. Keep in mind, though, that if you as an employer decide that you want to mandate that employees are going to shelter in place for 14 days if they travel out of state, I suggest that that rule be in writing, it be communicated to all of your employees ahead of time before they travel. And if you are requesting that or mandating that they do that, they're not entitled to this paid sick leave because they are not being advised by a healthcare provider to self-quarantine. They're being advised by you, the employer, to self-quarantine. There's a difference. So unless a healthcare provider has told them to self-quarantine, that time that they're spending, that additional 14 days, is just tacked on to their vacation, or ultimately it can be unpaid. So those are some of the things to keep in mind when you are bringing people in. When you have employees who are on this FMLA, I strongly recommend Kim McMahon's group for keeping track of those days. I can tell you that the most common questions that we get are related to FMLA and how to keep track of those days, especially when you have people using intermittent leave. And Kim's group is great at that. They can keep track of that for you, and that's one less thing that you have to worry about. So those are the highlights of the things that I wanted to address. If anybody has any questions or concerns, certainly we're available. For those of you who are ICRMT members, you know that you're entitled to the free Open Door Legal, where you can contact myself or Jane or Karen Anderson at any time with any questions that you may have.
Julie, thank you. That was wonderful. Concise as always, and that chart is going to be very useful to you folks. We will make available the presentation to all who participated today. So if you don't have the ability to do a screenshot of that particular chart, you'll have it included in that presentation when it gets sent to you. Again, the discussions that we've had in the last our three installments of the series have really focused on the critical element of engagement of the employee, and certainly Julie's discussion is no less and it's no less important in the identifying the legal landscape and what you have to deal with your employees. Communication is so critical so that they understand the who, what, why, and where, what their rights are. And you certainly as employers have to know what your rights are. But at the end of the day, without engagement throughout this process, and then taking it the next step, without engagement on your daily management of your businesses, your entities, your organizations, with your employees, whether it is absence management, whether it is employee benefits or workers' compensation, things begin to fall through the cracks and issues begin to occur. Next week will be our final installment where we're talking about the inefficiencies of the siloed approach to workers' compensation and employee benefits. We've identified those comorbidities that are both impactful to work comp workers' comp and employee benefits, as well as absence management. Yet in today's world and the world that we know as employers, those elements don't usually get addressed on a level or integrated basis. Next week, we're going to talk about the inefficiencies and the lost opportunities there, as well as some resources and tools that can be brought to the table to help you address those inefficiencies and hopefully close gaps where dollars are being lost. Thank you all very much for your attendance today. We look forward to you being part of it next week, and look this afternoon for the presentation to be sent out to you all. If you have questions, please don't hesitate to contact us, and we'll make sure that we get them addressed as soon as possible. Take care all, be safe, be healthy, and have a great rest of your week. Bye-bye.